We all have heard by this time that if you have a compromised immune system, you are more likely to be in trouble. Great question from Miss Wendy. What constitutes a compromised immune system? Do autoimmune diseases like lupus, alopecia, MS fall under this?
That's a great question. It's a question I'm getting from my patients since I'm a rheumatologist. But so classically, we think of chronic diseases that could affect your immune system would be chronic hypertension, heart disease, diabetes. Certain people with underlying lung disease are at greater risk for having a complication from a respiratory illness. Patients who are also currently being treated with immunosuppressive medicines, either, for example, for their arthritis, or patients who are on chemo to treat cancer, are obviously also immunocompromised. There is a varying degree of, I would say, innate susceptibility when you have a condition such as lupus or RA, but you're not being treated. We know that there is some altered immunity there, but how much of that is going to play a role in this particular outbreak as opposed to the flu or any other thing, we just don't know yet. So I would say the take home here is that for people who do have underlying autoimmune or inflammatory conditions who are not being treated with medicine, you're going to be even extra vigilant. Work from home if you can. That's the guidance that I'm giving my patients now. If you are on medicines that do suppress the immune system, you're full-blown in that category that you're at greater risk.
We heard from a number of patients actually, who are dealing with one malady in particular. Here's what Jess had to ask. Jess asked, I keep hearing that people with diabetes are more at risk. Does this apply to type 1 diabetics as well? I'm a 38-year-old type 1 and my blood sugars are not perfect. Am I more at risk? Type 1 groups have been asking this question by the thousands every day with no answers. First of all, remind us what type 1 diabetes is, and then if we can get an answer to Jess's question.
Oh, you're not going to hit me. So type 1 is generally considered an autoimmune disease. That's usually patients present when they're younger. They tend to be insulin dependent. Their bodies literally don't make insulin. Type 2 diabetes is generally referred to as insulin resistance. It's associated with obesity. That's where your body's making insulin, but you're not responding to it. Or you can't utilize it, I should say. But both conditions are characterized by elevated blood glucose levels that can have, significance in terms of chronic sequela. The specific question of whether or not a type 1 is more or less immunocompromised than a type 2, I'll be completely honest. I'm not sure that I can tell you specifically. What I would say is that poor glucose control in general, since it's associated with so many other consequences, would be the most important thing, not whether or not it's type 1 or type 2. If there's any endocrinologists out there who have a better answer for me, I'm happy to hear it.
Well, let me ask a question that all of us found fascinating, and it really speaks to where we are today, very different. I'm a student, Reggie says, at Loyola Marymount University. But with the coronavirus outbreak and the flood of information, both reliable and non-reliable, I was wondering if young kids, adults who juul, vape, smoke are at the same risk as elderly people for respiratory and other complications from coronavirus.
We got a ton of questions on vaping, by the way.
Lots. I've started seeing that, and I need to dig deep on that.
Yeah, please.
Oh, no. I mean, not at the moment.
Smoking and vaping equally affect the lungs. I won't say exactly equally, but vaping is smoking to a degree. So you're automatically lowering your immune system and lowering your resilience when you're vaping as well as when you're smoking.
Before we get to the question from Laura, I should also just note that for the purposes of this conversation, I don't know is a perfectly acceptable answer.
Yeah.
And there'll be plenty of questions that we just don't have an answer for. So I don't know in this case maybe exactly the right answer, because this is, as we've said, a novel virus. We just don't know everything about it yet. But let's see if we can help Laura in Pennsylvania. Here's what she asked. Laura writes, my mom is a teacher in an elementary school and has a compromised immune system due to previous cancer treatment. A mother of one of the students is in quarantine from being in close proximity with someone who has the virus, but they're allowing the child to go to school. Should the child also be quarantined? And is this safe for my mom to go to work?
So the answer, at least for now, and I think it may depend if you have a lot of spread in your community, the Department of Health may suggest otherwise. But for the moment, if somebody is being, now let's just define what quarantine and isolation are. Quarantine is you are not sick, but you've been exposed, and you need to put yourself in quarantine for 2 to 14 days, which is the incubation period. Isolation is if you're actually sick, and then you're in isolation because you don't want to infect other people. If you are an individual living in a home and you yourself are in quarantine because you were exposed, your contacts do not also need to be in quarantine, which means people who live with you are allowed to go out into the environment. The contact of a contact is not considered a risk. Again, if there's a lot of activity within your community of community spread, your Department of Health might say, listen, if one person in your house is quarantined, better to have everyone stay. But for the moment, when I spoke to our epidemiologist as of at least last week, contacts of contacts don't need to be in quarantine.
So, Sean Morrison, I can't even imagine how many questions you're getting as the director of geriatrics and palliative medicine. I'm going to give you something specific from this 74-year-old by the name of JCB, but it's really as part of a larger question that we're hearing a lot about, like, how old is too old? There are a lot of healthy 75 and 80-year-olds. There are people who are maybe not so healthy who are 60. In this case, this person says, I'm 74 with early onset COPD. I've had both the PCV13 shot and then PPSV23 for pneumonia protections, as have many other seniors. Are we protected, somewhat protected, or not? In other words, if I've gotten a shot, if I've gotten a flu shot, am I less likely to get this? What are you saying to the seniors that you deal with?
Right. So the first thing we're saying to seniors is what the question you had was, am I at risk? And the answer to that is we don't know exactly who is at risk, but we know that those over the age of 60 are at higher risk of having severe illness than those who are under age 60. And right now, we can't tell you exactly who's at higher risk within that group. What we also know is there is no current vaccine for COVID-19. So if you've had the flu shot, if you've had a pneumonia vaccine, even if you had a measles vaccine, that's not going to protect you from this particular virus.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.